Hello and welcome everyone to Transport Planning Society's lunchtime webinar on how we should prioritise investment in walking infrastructure. My name's Rob Goodall and I am Associate Director with Arup, but I'm also on the Transport Planning Society Board of Directors, and I'll be chairing the session today. But I have the great pleasure in welcoming Dimitris Potoglou, who is a professor at Cardiff University, who will be presenting some of his key findings for his latest research examining public preferences for walking infrastructure using a best-worst scaling approach. So today we'll be looking through how we've introduced an innovative instrument developed by his team to capture public priorities for walking improvements, share insights from a large UK-wide sample, and reflect on related research exploring public discourse around active travel and interventions such as low traffic neighbourhoods. But before we just get into that, I just want to present to everyone, if they aren't aware, who the Transport Planning Society are, some of our great work, and some of the good things about becoming a member of the society. So at Transport Planning Society, our work really focuses on offering a structured transport planning training program. We support industry-leading qualifications such as a chartered transport planning professional. We engage in national transport policy discussions, and we set the national transport agenda at national, regional, and local levels. One of our key aims really is to build a sprawling, diverse network of core members, fully engaged in an open and inclusive community, providing a possible forum to engage on relevant topical transport planning and issues. You might have seen many of our reach out and thought leadership pieces across our policy panel over the last 12 months. We also really want to focus on improving the public understanding and image of transport planning, promoting transport planning as a profession, getting a younger generation of people into transport planning. So why should you join the TPS? Well, hopefully many of the people joining the webinar today are already members, but if you're not, what you can look forward to if you do become a member is become part of a forward-looking member-led professional society, join a community of fellow transport planners and build a professional network that's both across public, private and academic circles. Also gain access to industry-leading qualifications and mentorship, some of the things I've already mentioned around the professional development scheme and chartered transport planning professional as well. This also gives people an opportunity to enhance your professional opportunities, work with many diverse voices and people from across the industry, challenging yourself to meet the industry benchmarks around quality and integrity, and really learning from others from across the society. Have your voice represented in a national policy debate. As I mentioned, many policy papers have come out recently where we've actively influenced at national level policy decisions, and also help transform that wider perceptions of the Transport Planning Society. So all the information about becoming a member of the Transport Planning Society is available on our website. We can share links to that at the end of the session. So I will stop talking for a minute and I'll hand over to Dimitris to take us through some of his research. Over to you.
Thank you, Rob. Yeah, firstly, let me share my screen quickly and check that everything is okay on your end. Can you see it? Yeah, thank you.
Thank you.
So, yeah, good afternoon, everybody. Firstly and foremost, thank you very much for the invitation. Thank you to Transport Planning Society. Thank you, Rob, for the introduction, Liani for the invitation, and Brogan for organization and support. My name is Dimitri Potoglou. Over the last 14 years, I've been lecturing at Cardiff University in the School of Geography and Planning, and I'm also course director for the Masters in Transport and Planning. The work that I'll be presenting shortly is supported by the CLEATS Global Centre. This is a UK ERI and NSF research initiative. Also by the Digital Transformation Innovation Institute based at Cardiff University, and also the Sustainable Transport Interdisciplinary Doctoral Hub, which was founded by EPSRC and was based at Cardiff University as well. So today's talk is about examining priorities for investment in active travel, and over the next 30 minutes or so, I'll try to sort of compress evidence from 4 different studies and publications we've published with my students and colleagues at Cardiff University. So we'll be looking both at walking and cycling, and also in a sort of more micro level priorities for road reallocation and cycling infrastructure. This study was inspired with my involvement in the past with some work I undertook about social care, where again the challenge was the same. Local authorities operate on limited budgets, and the challenge is to try to identify priorities. What are the key critical areas where funding should be allocated first compared to other sectors or domains? In order to improve the delivery of the service, or in this case, the delivery of infrastructure. Of course, local authorities have obligations. For example, here in Wales, we have a legislation now, the Active Travel Wales Act, which requires ministers and local authorities to take responsible steps to enhance the provision made for and to have regard to the needs of walkers and cyclists. So within that, there is the challenge of how we provide defensible, citizen-led prioritization of walking and cycling investments. And as I said, based on my previous work, this inspired the idea here as well to capture relevant aspects of walking and cycling infrastructure from a citizen's perspective. So the first thing we did was to look at what sort of tools we have available. What are the different ways where the quality of active travel infrastructure is being recorded and how improvements are being made. So I'm sure most of you know that the one series of ways to do that is audit tools, where they've been employed to record conditions of walking and cycling infrastructure and identify areas of improvement. So on the left-hand side here, I have different audit tools across the world that have been used, and the number of items, you see a great variation from as little as 27 up to 162 if we're looking at the Irvine, Minnesota inventory environmental audit. And the same applies as well for cycling infrastructure. Now, the key challenge with those tools, of course, they use to evaluate existing infrastructure. They very much focus on safety standards. They identify risk areas of physical infrastructure, and they are mostly used by expert assessors. The idea there is how we can take those tools, how we can transform those tools into something that could be used into an instrument that can be used by to elicit preferences from citizens. So this is the gap that sort of identified how we can develop instruments that collect evidence and enable citizen-led identification of priorities for future infrastructure investment. Of course, the other way to do so is public consultations, but often we find that these fail to produce quantifiable outcomes or clearly defined investment priorities to support decision making. So what we proposed in these studies was to use audit tools as a starting point and devise what we call a best worst scaling instrument to elicit citizen priorities with moderate cognitive burden for participants, a point that I'll stress shortly. So what is a best worst scaling experiment and what it can do? So the idea of a best worst scaling is to identify priorities, to identify ranking of different domains, of different items or objects or features. So for example, here we have an example of 21 different factors that correspond to walking infrastructure. And these came from a sort of processing or transformation of audit tools. So we identified 5 domains: safety, directness, comfort, attractiveness, and coherence. And then each one of those comprising of a set of different factors. Of course, now if we ask respondents to rank all those items, is a quite cognitive demanding process. Or if we ask them to rate them, so in that case, we may be led into biases because of cultural differences. For example, what is a 5 for me, for example, in 1 to 10 scale might be a 6 or 7 for another person. To avoid all these biases, what we can do is create subsets of those 21 factors and actually ask two much simpler questions to respondents to pick what would be the highest priority and what could be the lowest priority. And of course, given that we create different subsets, we can repeat the question multiple times with the same respondent. So the result of this is that we can obtain a full ranking of those 21 factors by just simplifying the preference elicitation or the task within, let's say, a survey questionnaire. What we present here is called best square scaling case 1, because there are 3 different cases, and later on I'll show another example of a case 2. This is called an object case, where in effect we have a number of objects, a number of factors, and what we're looking at is to elicit respondents' priorities onto a common scale. A little bit of background in terms of this study. We looked at both walking and cycling. So firstly, as I mentioned, we reviewed a number of audit tools across the world. And then we conducted a preliminary identification of the walking and cycling infrastructure related factors. And then we created the first version of a best square scaling experiment comprising of cards that as I showed here. The next step is to add a little bit of validity to this exercise. So basically, take it to respondents, 10 cyclists and 10 pedestrians, and conduct what is called a think aloud and verbal proving exercise. So we effectively sat down with participants to try to identify what might be their problematic areas with the phrasing of the questions or the presentation of the questions, and then try to revise them. When we did so with what is called the thematic analysis, so we tried to identify different topic areas of concern when we conducted this qualitative study. And of course, that helped to go back to the drawing board, so to speak, and revise the instrument prior to a large-scale fieldwork. And then we implemented the survey. So this was back in 2021. We conducted 2 different surveys, one for walking, so looking at the general population, adults over 18 years of age, and also the second one more directed into cyclists, people who were able to cycle, and they were cycling, so to speak, regularly. As I mentioned, this exercise could be repeated multiple times, so we offered 7 to 8 choice cards per respondent. Now, there are different ways to analyze this data. So either count, for example, how many of those factors, 21 factors, were selected as highest priority, and how many times were selected as lowest priority, or even use more advanced econometric models to identify priorities. A little bit of background on the cognitive interview. So that was a completely sort of side study, self-contained study. So developing the best square scaling interview instrument, we went through a qualitative data collection with 20 participants, and we transcribed all the interviews and conducted a thematic analysis. So that was an opportunity not only to validate the best square scaling experiment, but also better understand how participants approached the task. For example, a lot of participants mentioned what is the sort of frame of reference, under which conditions were they asked to make those choices? Were they traveling, for example, or not? And also the understanding of the description of the factors. So the wording, whether there were overlaps between factors, any negative phrasing, and also the trying to correct for technical language. You'll see some of those lines here, some of those statements are underlined, which meant that there was a link here in case that we found that people had difficulty in understanding the statements. We had additional definition as a pop-up once people clicked on that link. So this is the final sort of instrument for the working infrastructure. As I mentioned, we had 21 factors, but each version here presented a select of 5 factors, and we asked people to choose the highest and lowest priority. So the key setting here is something we corrected during the cognitive interviews, that we put it in the context that the local council is planning to improve infrastructure. So we were asking them to weigh the pros and cons out of this list of 5 elements and then choose which one would be highest priority and which would be the lowest priority. So this is one way of presenting the results, so to speak. So here we present the ranking of priorities. So those that are on the right-hand side and have a positive value, what we call here a best-aware scaling score. So the top priority, for example, here was footpath provision, and the score of 0.65 meant that this item, this factor, was most likely to be selected as priority, rather highest priority than lowest priority. The second most important factor was footpath condition. And this is averaged over the 5 appearances of this factor within the different cards. Lighting, footpath width, and buffer zone. So these were the top 5 priorities. The set of the least priorities was around walking barriers, footpath materials, crossing weighting, traffic noise, and gaps in traffic. It's worth making a couple of points here. Those that were in the middle, for example, those were items that either rarely selected as highest or lowest, or they broke even. So some participants identified them as high priority, but also there was a significant group of respondents who identified those factors as lowest priority. Another element of this graph is this standard deviation. So this shows the variation of respondents in terms of being identified highest priority here. So the longer, let's say, the line here, it means that we have more variety in preferences. The smaller the line, it means that preferences were more concentrated. So we have higher sort of certainty that the score was 0.21 in the case of traffic control devices. Similarly, for cycling, we identified 25 different factors. So again, we have 5 categories. So comfort, safety, directness, cohesion, and attractiveness. And these again broken down into the individual factors, the 25 different factors we presented to respondents. So again, the idea is that the council is investing in cycling infrastructure, and we are asking cyclists to, out of 7 cards, to indicate what would be the highest and lowest priority. So again, here we have now a set of factors corresponding to cycling infrastructure. So the 5 most important ones were dedicated pathway width, conflict with heavy goods vehicles, conflict with junctions, and surface quality. And the 5 least important factors related to fear of crime, gradient, deviation of route, delay at junctions, and noise pollution. And again, those in the middle were those that were rarely selected as either as highest or lowest priority, or again, they broke even. So in summary, these are the top 5 priorities for walking infrastructure. I should mention that this was a nationwide sample. So the key areas of improvement is around directness, comfort, safety, and again, another element, footpath width, for example, comfort and safety. And in terms of cycling, the number 1 priority, adequate separation between the road and pathways. Number 2 priority, adequate path width to prevent conflict with other users. So again, areas around comfort and safety, for example, measures to avoid conflict with heavy goods vehicles, measures to reduce the risk of collision at junctions, and pathway free of defects such as potholes, for example. So a little bit of reflection here. What we have done is a sort of a citizen-driven identification of priorities for walking and cycling infrastructure improvements under the constraint of financial resources. Results can point to point areas by key pressing areas considering user needs, strengthening democracy because we just directly ask the users where funding should be directed, and fostering pedestrian-friendly environments. And of course, we use the methodology that is less frequently used in transport and mobility studies, the best for scaling, which are free from cultural contextual biases, and that allows comparisons, for example, across regions, nations, and other countries. We avoid the sort of biases of having rating exercises, for example, and all those 25 factors or 21 for working could be all sort of very important. So people would score them, 9 or 10 out of 10. So it's very difficult to differentiate. Or if we are thinking about different cultures, obviously, as I mentioned, there are differences in scales and how people perceive a score of 5, a 6, a 7, so on. So this was a summary of sort of 3 studies looking at walking, cycling, and the cognitive interviews, the validation of the instrument. In the next few minutes, I'm just going to go through another study which just looks at more at the sort of local level, and it has to do with urban street space reallocation to encourage cycling. And again, the motivation there was around traffic restrictions and the construction of cycling infrastructure, which are basically strategies to reduce private car use and promote active travel. But of course, there is a lot of controversy, and I'm sure you've come across that in terms of public support and also vocal opposition by some local communities and groups. So a critical factor in the acceptability of new infrastructure is their design, and prior evidence has shown that design shapes support via perceptions of safety and cyclist route choices. So looking through the literature, we found that most of the evidence focuses on cyclist preferences and not the views of the wider users. So this was the sort of motivation of trying to investigate public preferences for reallocating street space to accommodate new cycling infrastructure with focus on different design configurations. So the idea was very much along the same lines as previously, but with a small difference. So previously we had different domains. So in that case, we had 25, 21 for walking, 25 for cycling. Here we only had 3 of those domains. So we had bike lanes, traffic restrictions, and cycle parking. But the difference now was that bike lanes could have different levels, different configurations. So it could be no bike lanes, or bike lanes aggregated from motor traffic installed eliminated 25% of the road space, or 50% of the road space, and also additional features, something like wide bike lanes installed taking up 25% of road space or 50% of road space, or taking space from pedestrians. In terms of traffic restrictions, now we had three levels: whether traffic is allowed with no restrictions, it could be resident-only vehicle traffic and emergency vehicles, or allowing traffic between certain times of the day. And finally, cycle parking could have three levels: either no parking, or 1 in 10 car parking spaces, or 1 in 5 parking spaces. So the difference with the previous exercise is now we are interested in the ranking of the levels rather than the ranking of the three elements here. So the idea is to go back to respondents and try to elicit or find out what would be the key priorities for urban street reallocation. So this methodology is called best square scaling type 2, or profile case, because we are interested in the profiles of the original attributes. So what we did here was, obviously we presented the sort of baseline case where there was no intervention, just the regular road with sidewalks on either side, and then no cycle parking at all. Then we created 27 different images representing those different configurations. For example, here on image 1, we had no cycle lanes, all traffic allowed, but there was provision of 1 parking space allocated to cycle parking. In this case, for example, we had painted bike lanes taking up 25% of the road space, all traffic allowed, and 1 in 5 parking spaces removed to make space for cycle parking. So the aim was to identify priorities for different levels. So for example, how important is A5 painted white bike lanes installed taking up 50% of the road space relative to a reference level, something like no cycle parking. Again, we conducted a study with 386 adult participants across the UK. We recruited them from the Qualtrics survey panel, and we identify quotas so that we can sort of approach representativeness across age, gender, and ethnicity. So broadly speaking, the sample was representative with a few sort of discrepancies in terms of having older participants and missing or having underrepresentation of ethnic minorities. But the sample was representative in terms of age and gender, for example. Sorry, gender, not age. So again, this is the sort of headline findings. The farther the point is from 0, it means the higher priority. So in this case, for example, the highest priority was to reallocate space for cycling, taking up 25% of road space, and with no significant difference, statistically speaking, to have painted white bike lanes taking 25% of road space. So the key message is here that respondents would like space to be taken up from road rather than pedestrians to allocate them onto cycle lanes. In terms of traffic and emergency, in terms of whether traffic was allowed or not, the key priority would be to have resident-only vehicle traffic and emergency vehicles. But again, if we see the overlap here, so statistically speaking, there wasn't much of a difference, but there was a majority of respondents who opted in for, saw that as a higher priority. Also, there was preference for parking, for cycling parking. So 1 in 10 car parking spaces to be removed and make space for cycle parking. The next step here was to look at different groups of subgroups of respondents. So we had questions which basically helped us to segregate, to group respondents depending on their identity. So for example, here we show results from those who identify as drivers and those who do not identify as drivers, and also those who identified as cyclists and did not identify as cyclists. So we have different attitudinal questions that helped us group the sample into the different sort of identities. So sort of three key messages here. Drivers had a stronger preference for the redistribution of footpath space for cycling than those with a lower driver identity. Drivers were particularly against removal of parking spaces for cycle parking, and also those with high cyclist identity gave a score close to 0 for all traffic restriction options. So a little bit of a summary out of this study. So where space comes from is important in the acceptance of bike lanes and traffic restrictions. So people dislike the removal of car parking spaces. I think that was a sort of a friction point, and preferred the distribution of road space rather than footpath space. They preferred segregated infrastructure over painted bike lanes. Preferences depended on whether a respondent was a cyclist or driver. We also looked at identities related to place attachments and infringement on freedom. And we provide key directions in terms of policymakers and those who work in urban design to identify what is acceptable to the public when making streetscape changes. And these preferences for both segregated cycle infrastructure and space needs to come from road, or these are people's view, rather than pedestrian space, which is in line with the UK government's guidelines for new cycling infrastructure. So with that, I will sort of conclude. I hope I was on time, Rob. I would like to thank you very much for the opportunity to present our work. And I should also mention my former students, Fahad Al-Bakhlal and Isabella Lambert, and also my colleagues, Dimitrios Xenias and Wouter Portiga, who we collaboratively worked on these projects. So yeah, thank you so much. By the way, I also have a list of sources here if people want to follow up on what I have just shared with you.
Brilliant. Thank you so much, Dimitris. And yeah, thanks everyone else for listening in. So we now have around 25 minutes left. We want to use about 20 minutes of that to answer some of the questions. So please do, if you've got any questions for Professor, please do put them into the comment or the chat. I think there's a number of really interesting insights that you came up with there through your research, and a number of things that transport planning practitioners and people working in the industry can really take on board when we are both working in policy, strategy and design of active travel schemes, especially when we are looking towards balancing of priorities across multiple different users and what modes they do use. So any questions or any insights that you do have, please do put them in the chat and we'll try and answer them now. As chair's prerogative, I suppose I get a chance to ask you some questions directly. So it's okay, I'll just start off with hopefully a relatively easy one to ease you in. But do you have any thoughts about how you see this research influencing policy directions or development of policies by national governments or regional or local authorities? Have you investigated how you might try and socialize some of the outcomes of this research with those people that are in that decision-making position?
I think, yeah, we have shared our findings with Transport for Wales, for example. We work closely with them, so we try to sort of in every opportunity to share our findings. I think next month, for example, there is Active Travel Wales conference where we'll presenting some of these findings, but also some work we've done on cycling in pedestrianized areas at Bridgend. So yeah, we try to sort of seize every opportunity and engage with stakeholders. I think that this is a nice opportunity as well to reach out to professionals, um, and yeah, share our findings.
Great, and thank you. It's a really good way to get it out into the public domain and more people to see this. So we have a couple of questions in the chat, so I'll try and raise those now. So we have a question from Bethan, I think, that says, I think this research is really good and it sets the conditions for addressing user concerns. However, she raises concern around wheelchair users or those that can't imagine cycling are being excluded, which could bias the results of the research. Is that anything that you considered as part of the work you were doing?
This is a very fair point, and thank you for raising it. I think, yeah, the sample of users we have for cycling, um, we kind of specifically looked at the time those able to cycle, but I think it's a very fair point, including wheelchair users, for example. The only difficulty there, one was during the COVID period where there were lots of restrictions, so we could not reach out to the wider population and possibly conduct face-to-face interviews. I think that was one of the challenges, and also um, it was very difficult to reach a good sample size of wheelchair users, for example, at the time. So I think it was a practical difficulty where um, that subgroup of the population was not included in these findings. But we've been trying to develop proposals over the past few years to look in particularly um, into studies of involving people with disabled people. So it's not an element that we have put on the side in a way, but for those particular studies, it was just the practical considerations, and I do take the point. Thank you.
Great, thank you. And we've had a further question from Serpi, who asks, how did you arrive at the sample size of the survey?
Yeah, we went through quite of sort of a careful calculation. We looked at the sort of the health survey, which published by the ONS. That was the 2019 health survey. And for the walking, for example, we particularly concentrated on those people who had either fair or very good health. And based on that, then we calculated the number of people. It was about 40 million out of 49. And we sort of calculated the sample size on a 95% confidence level, especially for the walking sample. For the cycling one, obviously, we had sort of more loose criteria other than specifying quotas for age and gender, because one of the sort of criterion we defined was people able to cycle. I could have a quick look to see whether we have more details there in terms of the sampling, but yeah, I'm quite certain about the walking sample.
Great, thank you. I've got a couple more questions as well. I think focusing on the space reallocation work that you were looking at,
Mm.
as practitioners and people that work in the field, and myself with that type of experience, you could suggest that some of those outcomes were not very surprising.
Sure.
People that enjoy walking and cycling want to see more space given over to walking and cycling and seeing more separation. And whilst those that drive and use parking spaces want to see more space dedicated towards them, I suppose. Is there any reflections from your work? Is in an ideal world where there's space to accommodate all those things, and that is, the optimum way we provide everything for everyone. In reality, that's often not the case, and difficult decisions
Mm.
do need to be made. Is there any thoughts from yourself about how we might best use that, the outcomes of that research to
Yeah.
better design spaces for people?
There's no doubt. I mean, yeah, you don't see anything surprising there. I think the key difference is that you can identify the priorities and you can say how many times one of those elements is important compared to the other. So when you are thinking about prioritizing, you do have a good sort of evidence, good piece of evidence to tell you that what is the sort of key priority for that people would like to see being improved. For example, introducing bike lanes and having those separated from traffic. Um, and also, yeah, it gives a bit of an indication of, how much, for example, we had variations of 25 and 50% of road space. And people were more inclined for 25% of road space rather than 50% of road space. Um, and also, yeah, the considerations about parking, how much is good enough, you see, and there you sort of both identify the friction between drivers and others, but also it does give an indication of how much is acceptable by different groups. I think that's the sort of the key evidence we bring to the
Mm.
table. Yeah.
Yeah, and I totally agree. I think that's where it really becomes useful, is that um, actually when we're talking around road space reallocation, it feels very polarized in terms of it, different viewpoints are very entrenched, and there's no room to maneuver between those. But actually, in reality, people are a bit more conscious about the need to share space with other users and interact with them in different ways. So actually meeting in the middle by utilizing some of this research and insights is actually a really good way to reach consensus
Mhm.
around some of these schemes. So no, I think that's really useful.
And the
We have,
other
oh
element,
yeah.
sorry to interrupt, and the other element is that you could also think about comparisons, comparing different regions or different settings, or nations, for example, England versus Wales or Scotland, um, and yeah, see how those priorities sort of pan out.
Great. Yes, absolutely. We've got another question from Tristan from the comments, who's asked, could this be merged with considerations for disabled people, people with mobility impairments? So, for example, if a dropped curb is essential for mobility impaired, disabled, but a low interest for average sample person, would it drag the score up? So, I don't know what your reflections on that are.
Yeah, at the moment, as I mentioned, we don't have a specific subgroup within the sample that corresponds to disabled people. Um, And it's hard, I think, to speculate or to hypothesize. I think it's a matter of testing the instrument and possibly modifying it to correspond um, to disabled people, and see, because obviously some of the features are slightly different. And as I said, we made a couple of attempts to sort of develop studies, and we are still keen to develop specific studies between for active travel of disabled people, wheelchair users and so on. Yeah. So the idea is still floating. Yeah.
Yeah. And another question from me, if that's okay as well. So,
Mm.
and this sort of plugs into our one of our next TPS events. So we have which I'll talk about in a bit towards the end of this webinar around future events. But we are holding a session around designing equitable communities, rethinking transport planning through a gender lens. It'd be quite interesting. no, it wasn't done explicitly through this research, but how I suppose it would be interesting to understand whether some of those preferences and those priorities may change depending on gender, and actually how they placed different priorities on different elements. It's
Mm,
it's interesting to see that lighting was really up there with one of the priorities for walking, whereas I know there's a nod to that in some of the design guidance that uh, that many practitioners do use when we're looking at active travel and mobility design. It's referenced, but there's not exactly specifics around it, whereas that is really high, put as a really high priority through your research. Do
mm.
you think there was any significant differences in demographics, or did you not look at that, or is that something maybe to focus on in future further research?
We, as far as I remember, there were no significant differences between across genders. Um, we did a little bit of analysis, exploratory analysis between different living settings, for example, urban, suburban, and town and smaller or smaller. And as far as I can see here as well, there were no sort of significant differences in the ranking of priorities when it comes to working, for example, to working infrastructure. Maybe slight differences between um, urban, suburban, and town, but only slight. I think the top five factors being footpath condition, footpath provision, width, lighting, and buffer zone were again the top five with just a slight reorientation in terms of their ranking. But yeah, generally speaking, the top five priorities were the same.
Yeah, thanks, Demetrius. I think that's
Yeah,
really interesting, and yeah, it does lead into that. How do we do design equitable communities for people and streetscapes? So it was really interesting. One of the main takeaways I took from it around was the continuous footways being really high priority, and actually having walking as a priority over vehicular traffic, and cycling. Some of the preferences around the priority was again separation from vehicular traffic. Again, it's quite similar
hmm
in terms of a quite a strong focus on safety and the perception of safety, of how
hmm
separated you feel with vehicular traffic on streets. I think it's quite an interesting takeaway, just to have that real evidence and to back up through research a bit of what we probably understand from talking to communities directly. So that was quite useful.
sure.
Excellent. We don't seem to have. Oh, yep, we've just got another question come up in the chat, so that's fantastic. So, a question from an unknown user. Sorry, I don't have the name, but they've asked: most people don't walk or cycle as a main mode. So, when you selected the sample, did you define the usual mode of respondents as active travel? Are there views of
hmm
car users embedded here to a degree?
hmm Yeah, a couple of things to clarify here. With regard to the cycling infrastructure, those were people who were actually able to cycle, and we did record their sort of level of engagement. Um, with walking, as far as I remember, we did not record. It was just a matter of asking whether they were able to walk or not, which kind of determined their eligibility. But I don't remember whether that was regular, what was their regular mode. Um, for the road reallocation there, we did capture the sort of not the mode, but their identity, so to speak, whether they had a driver's identity or a cyclist identity. And, the graphs I showed kind of show the differences in their preferences. Um, so yeah, the answer is yes and no in a way. Not so much for walking, but yes for cycling, and also in the street reallocation. Um, yes, in terms of capturing the identity, how people sort of identified themselves in the context of travel.
Fantastic. Excellent. Well, that's been a really useful and insightful discussion. So thank you so much for answering those questions, many of them
Sure.
my own. So thank you for indulging me. I really appreciate that. So um, I don't think we've got any more questions from the live stream. So Demetrius, before I do move on and talk a little bit more about some of our future events, is there anything else you'd like to say or summarize as part of your chance now?
No, thank you so much. Yeah, thank you again for the invitation, and thanks to everybody who devoted their time to attend this session. So really grateful.
Thank you very
Thank
much,
you.
Demetrius. And yeah, I'd like to thank you. Thank you for taking time out of your very busy schedule to come and talk to us today. Hopefully, everyone
Sure.
listening in online has found this really interesting. We do actually have one more question. So before we dive off, sorry, we will just ask. So Tristan's asked another question. So thanks for engaging, Tristan. So, do you think this sort of project could be extended to things like designing attractive high streets or public parks? Or is there a point where there are too many variables and individual preferences?
Hmm. Yeah, absolutely. I mean, one of the reasons I want to talk to this community is to try to identify whether there are any synergies and possibly new projects. So one definitely around disabled people, another one could be, yeah, because the instrument could be modified or designed to address specific type of settings and research questions. Um, the idea is that we can have a long number of different factors and we can think about, yeah, I mean, the method helps to sort of try to make it manageable. And it is indeed possible to work with many variables across different settings. So yeah, that's possible.
Well, thanks, Richard. And one more question as well, actually. Have you considered children as users? Because I know you've said users over 18 as part of your research.
Yeah.
Were the young people considered at all?
Well, not in these studies, but again, as I said, happy to have a discussion. We've done a little bit of work in the past with sixth form students, but that was a long time ago. Happy to discuss. Yeah, please email me, and I would be happy to get in touch and discuss opportunities. Sure.
Thank you very much. Hopefully that's all the questions answered. So thank you very much. And yeah, like I was just about to say, thank you so much for your time. Really appreciate you coming to speak to us. I think it's been really interesting. And yeah, if you want to share links to any of your research, then please do, and we can follow up with that as well with attendees. So that's really useful. Um, just to wrap up, we've got about eight minutes left. I just want to talk for a couple of minutes about some of the events that we do have coming up for the Transport Planning Society. So, firstly, if you've enjoyed this session today, hopefully you have. I found it really interesting and insightful. Please do reach out if you've got any ideas for future events and speakers. We'd love to have Demetrius back in the future to talk more about some of his research in this area. I think that'd be great for us as practitioners in the field. But if you do have any ideas, please do reach out to myself, Brogan, or Liani, and we can share details after that about how people can reach out. We have events coming up. We have our annual general meeting on the 5th of March at 6 p.m. All members are invited to join that. And following that, we have our Transport Planning Society annual lecture. So this will be done by our Transport Planner of the Year, David Wilson, who is presenting on the topic of reimagining the curbside, a vision for fair, healthy, and future-ready streets. So you can register for that event separately. All the info is on our website. Again, we can share the link to that if people would like to sign up. It's also being advertised by the Institution of Civil Engineers as well. Later on in March, we have the TPS annual quiz. Hopefully everyone's seen that on social media. We have in-person locations confirmed in Cambridge, Cardiff, if you want to go down, Dimitri, Exeter, London, and Edinburgh. So we've got lots of details again on the webpage. It's the event of the year. It's always good fun and good to meet some of your co-professionals at those events as well, and how you can register for those again on the website. I did mention our next webinar that is coming up. That is on designing equitable communities, rethinking transport planning through a gender lens, being organised by another one of our board directors, Jolie. So she set that up. That is at WSP Chancery Lane on Wednesday, the 29th of April. It's a hybrid event as well, so people can dial into that. That is starting at 6:30, I believe, so an evening event for people to dial into that. So please do, again, look at our website, look at LinkedIn and other social media to see how you can register for those events. We'll also be doing a number of these other future events and webinars around some of the findings from our policy groups in the next couple of months. So more of this will be shared coming soon. One of those will be on active travel, actually focused on around whether investment in active travel has actually led to a shift in the way people travel and those behaviours, and is that funding been enough? So watch out for that. That's also going to be followed up by a thought piece done by our active travel and micromobility policy panel too. So hopefully that is interesting to people who have joined this one today. And finally, just to mention, we are going through a process of electing new board members from April. So if you are a member, you would have had an email notification come through about voting in that process. We luckily received 14 nominations for 9 new director places on the board. So please do engage with that process as well. We'd love to hear back from you. So thank you very much, everyone. Thank you all for your time today. Really enjoyed it. We'd love to hear any feedback on our events or anything we've got planned in future as well. So please do reach out. It's been a pleasure having you all, and I wish you a good rest of your day.